All right, so today what we're going to do is demonstrate and show you how the Sigma instrument or shockwave therapy works along with the analysis. So before we get to why we have my skeleton Fred here, I'm going to show you how this instrument works, and then I'll actually apply the theory and how it works to Fred. This guy, he was waiting in the lobby a little too long, and he's now dying for an adjustment. So we're going to show you first how this instrument works. So this instrument has a piezoelectric sensor, which is a crystal in the back of this handpiece that is extremely sensitive to vibration. So this instrument literally measures the sound frequency of material when I test tap it. It measures vibration, and I'll prove it to you right now. So soft, mushy material, if I tap on it, it has a low pitch tone. You can hear it, it's not very loud. Harder material has a higher pitch tone, and it's very resistant to motion. So when I test tap hard material, it's going to show a high pitch curve. And when I tap mushy or soft material, it's got a very low pitch curve, and I'll show you right now. So if I test tap this piece of wood, you'll see here, it's got a very high pitch curve. It's very consistent, computerized, and predictable. If I use the same theory and test tap this mushy material, you'll see here, it's got a very low pitch curve. In fact, you can barely see it on the analysis box. So what we do after this is I actually select what I want to adjust. Once we select which areas we want to adjust in the spine, or in this case, we will select which parameter set. So when the area is very, very stiff, we're going to loosen it up with a very fast frequency, which is gentle tapping. It's a percussion sending a shockwave. So there's no electric signal, there's no electricity. It might sound like it is, but it's very gentle tapping. So we're able to move joints with a bunch of small inputs, not one big, large motion. So if people are hesitant of a twist, popping, or cracking type of manipulation that a chiropractor would give, this would be a great instrument for them to just gently loosen the tissue and reset the compliance of the muscles around the spine. So as you can see, I can change how fast this instrument works in order to tell the tissue to either tighten up or loosen down. So once we're done, we will actually go back in and re-scan and just test and make sure that we have a good working spine. So here's an example of a spinal scan that's not working properly. Here's a before and then an after. What we're looking for is a straight red line and a nice pretty rainbow. So now I'm going to show you what it looks like if I were to apply it to Fred's upper neck. And here we go. I'll go ahead and clear the screen. So what we're going to do is we're measuring the movement of these joints right here. Every joint in the spine should move a little bit, which equals one large range of motion. We're going to affect these joints right here. These are called zygoapophyseal joints, also known as Z joints. The thing about these joints are they're packed with a bunch of nerve fibers. Some are pain sensors and other are position or movement sensors. So if a joint is locked up and stuck, not only will it hurt and create inflammation and pain, but it also will tell the brain that it's not moving. It'll give abnormal signal to the brainstem, which can contribute to poor brain health, actually. There's more budding research from Harvard University showing that a spine that moves nourishes the brain with neural impulses, making the entire human a healthier, happier individual. So here's what it looks like. We're gonna go in and just gently test tap each joint to make sure it moves. What I'm going to do here is select the ones that are out of normal range. So these all curves look about the same, but you can see those two, in this case, are moving a little bit differently. So I would select the two lower curves and then do an adjustment. You can see what it looks like right here. It's just gentle tapping, and I can just do micro movements to help loosen that area up. So it's computer guided, it's gentle percussion, it feels good, it's consistent, and it's comfortable. Patients typically love how this feels. When it's done measuring 10 of the same vibrations in a row, the instrument shuts itself off. So that way, every time I'm assessing a patient, it's consistent and computer guided. That way it's reproducible every single time, which lends for quick results and also longer lasting results. It's very predictable. So again, we'll go in and actually do a mock rescan. I wouldn't expect to change too much since it's being it actually looks like I give Fred a good adjustment here. So Fred's is a movable specimen, so we actually can appreciate a difference in movement characteristics in this case. Here will be a before, and here's an after. The more chaotic the screen looks on this rainbow feature, the worse the patient will feel. The more synchronized and tighter the rainbow, the better a patient will feel and function. And that's how we use the Sigma instrument in the ultraline.